achalasia, disease of the lower esophageal sphincter. Sometimes patients have a hard time swallowing food. No one really knows where it starts and what's the cause of it. There are some theories. Patients will go to the gastroenterologist, they have a hard time eating, they get an endoscopy, it shows that the muscle on the lower part of their esophagus is closed, and it's not allowing food to pass through it. So it's a very miserable way to live, because basically patients can't eat, and then it progresses to then they can't drink, and they lose weight. It's a pretty hard disease. It's not common, but also it's very hard to find someone who can treat it, surgically and endoscopically. And we're able to do both. And that's, again, another thing that we're very proud of, that we are able to do this depending on the patient's situation. For example, some patients have had multiple abdominal operations. They cannot really have a surgical procedure to correct this. Then they would be a good candidates for an endoscopic repair of this, where we basically go in endoscopically and cut the muscle on the esophagus and relieve the pressure, which is called the POEM procedure. And the POEM procedure has been developed in Japan and developed by surgeons. And it's a very advanced microsurgery that allows us to go into the lining of the esophagus, cut the muscle, close the lining, and a patient can go home within 24 hours without any surgical intervention. On the other hand, some patients have significant acid reflux associated with their esophageal problem. These patients may not be a candidate for endoscopic repair. These patients may be better candidates for surgical repair, where we cut the muscle surgically on the outside and then create an anti-reflux procedure, repair the acid reflux in the same time. Now think about this, and that's where it gets really, interesting, where one doctor or one surgeon can repair your esophageal disease, can repair the acid reflux, can do all this in one operation, either endoscopically, laparoscopically, or robotically. And you can find all that in one practice. And that summarizes what we all stand for.
And that comes in particularly handy in certain patients that have multiple diseases in the same patient. We had a recent patient who had both achalasia, an esophageal problem, like you said, with the tight muscle, who also had morbid obesity and gastric reflux. In this particular patient, any one of the procedures would have caused a different enhancement of some other aspect of their disease. So we were actually able in this patient to go and do a Heller, which is the surgical cutting of the muscle fibers, and then perform a gastric bypass to relieve both the reflux and provide weight loss for the patient. And this is something, so a patient basically got a 3-for-1. In one setting, they were able to treat all three problems. They were able to eat for the first time in years. And that's pretty cool, that you can do everything for a patient and make sure they do the best. And that's something rare. Most people can't do.
Exactly. It's very rare. It's very rare to find this level of experience, skill, different approach, different vision, all coming together to make one treatment algorithm for a patient who has 3 different problems. Can all be treated with one operation in 2 hours, where the patient is able to eat, get rid of the reflux, and lose weight. And that just sums it all up.
I think it's important that also that we all here have advanced training in esophageal disease, acid reflux, and all these things play a role and are interconnected. So it's extremely important for patients to have a thorough workup, a thorough understanding of their disease before we arrive on the correct procedure or the correct intervention we need to take to help them out. And I think because we have that expertise here, we have the option to do both the endoscopic and the surgical options. We have a full understanding of the disease process. We can tailor the therapy and the procedure to what that patient needs. And in doing so, we ensure that the patient has the best possible outcome.
I think Dr. King brought up a good point. Some patients come in thinking that they need a certain surgery, for example, for heartburn. But other entities, other benign esophageal diseases can present with heartburn. For example, achalasia can also present with the symptom of heartburn. So it's important to have this full spectrum of workup and diagnosis and analysis before the surgery happens to ensure that that patient gets the surgery that's going to help them the most.
Correct. And understanding the testing, not just sending the patient to get a test or a diagnosis, but actually the ability to interpret these tests, sometimes as good as the person performing the test from other specialties, and sometimes better and sometimes more experienced, depending on the situation. But the ability to send a patient for a test, the ability to interpret this diagnostic test, and the ability to formulate a treatment plan which meets the most advanced standards in surgery is really something that's rare to find.
Yeah, and the fact that a picture is worth 1,000 words really comes true in this point, because we have all our patients, they know if they have an imaging study done, we don't care about the report. We want to see the DVD or the CD with the imaging on it. If they have a test called manometry to look at their esophageal pressures, we want to see the curves, the compression, and see the transit of how the wave is progressing. And a lot of times we'll see things that are misread. And this is so key, so we can get the full picture and we're able to actually understand that picture. That's so important.